Namaskar. Welcome to this module on healthcare delivery systems, healthcare matrix and the role of a hospital in this. Herein we are going to talk to you about healthcare delivery systems at the international level, healthcare delivery systems in India, role of hospitals in healthcare delivery systems, and we are going to classify hospitals by various kinds. So what we are talking first is, what is health? Health has social, physical, mental and mental well-being, which we have covered in the previous modules. Here what we are going to talk is preventive, promotive treatment of diseases, illnesses and injuries which people have. So the healthcare delivery has the following components. It has governance, it has advocacy, it has capacity and it has information. So what we are going to do is, we are going to talk about promotive, preventive and protection of the people. So in prevention we are talking about screening for health and vaccination. In promotion we are going to talk about the individuals promoting health behaviors, improving their social and other determinants of health. So we are talking about protection, wherein we are giving them protections from environmental hazards, we are promoting healthy workplaces for them, we are controlling the infectious diseases and we are managing health emergencies. So the international healthcare delivery systems are people-centric and integrated with the healthcare services and are critical for reaching universal health coverage. People-centric care is focused and organized around the health needs of the people, and it's not focused on diseases, it is focused on the needs of the people. So it's a people-centric approach rather than being a disease-centric approach. So in the integrated health services, they encompass the management and delivery of quality, safe healthcare services, which is health promotion, disease prevention, diagnosis, treatment, disease management, rehabilitation and palliative care services. So what is the WHO saying to its supporting countries? It is saying that we have to implement people-centric integrated health services by way of developing policy options, reform strategies, evidence-based guidelines and the best practices that are tailored to various countries' contexts. So healthcare delivery system in India. India, as we know, is having a structure of local governments, central government and there are 29 states and 7 union territories in India. So health is a state subject in India and states are largely independent in matters relating to the delivery of healthcare services to the people. Each state has its own system and its own way of carrying out the healthcare delivery to the people. But central government has certain responsibilities which are like policy making, planning, guiding, assisting, evaluating and continuing coordinating the work of various health ministries. The official organs of the healthcare system at the national level is the Ministry of Health and Family Welfare. Then there is a Directorate General of Health Services and there is Central Council for Health and Family Welfare. So there are two types of healthcare systems in India. One is the public healthcare sector. Public sector, as we know in India, is the sector which is governed by the government and provided by the government. It is owned by the government and the private sector is primarily for-profit providers of healthcare services. But in the private sector there are not-for-profit organizations, there are voluntary organizations, there are social organizations, and there are various other parties. So, the types of healthcare delivery systems in India are indigenous systems of medicines, which is being provided by the voluntary agencies, and there are a lot of national programs. Now, what happens is, in India as of now, bulk of the healthcare services are provided by the private sector, and people are paying out of their pocket for these health services. Levels of healthcare delivery systems. So, there are primary level of healthcare systems. So, there is a 3-tier system. The primary healthcare system. So, the primary healthcare systems is the first point of contact to the healthcare services. There we may have physicians, we have midwives, we have nurses, and we have health promotion, illness prevention, and the health maintenance programs and home support and continuity of cares and etc. So, primary health care is very important component of this 3-tier system. So, principles of primary health care are equitable distribution, community participation, intersectorial coordination, and appropriate technology. So, secondary healthcare system is the system at a second level, which is referred by the primary healthcare system. So, this is a level of a hospital. Most of our hospitals are secondary healthcare facilities in the tribal areas, rural areas, and far-flung areas, and the secondary healthcare includes district hospitals, community healthcare centers at the block level. So, elements of secondary healthcare are allied health professional, physicians and physical therapists, respiratory therapists, occupational therapists, speech therapists, and dietitians. We have family planning services wherein we provide contraceptives and other family welfare services. We have safe abortions, we have school health services, and we include safe storage of blood, essential laboratory services, referral transport services, and maternal death reviews at this level. So, then we have sub-centers, primary health centers, and community health centers. So, sub-centers are 1 for 4,000 population, primary health centers are 1 at 30,000 populations, and community health center is 1 at 1 lakh populations. So, we have in a sub-center a staff of 3 to 4 people. We have no beds at the sub-center level. A primary health center could have 13 to 21 staff members and could have 4 to 5 beds. A community health center would have 40 to 50 people and it could have 30 beds. So, now we come to what are the kinds and types of staffing which is required at these levels. So, what I would recommend is that maybe we go to the reference material which we have provided and we do the equipmenting, staffing, and the kinds of drugs and medicines and equipment that is available at each of these centers. This has been given in detail with the reference material which we provided. The IPHS standards has details on all this, which we are going to cover in some of our subsequent modules. So, tertiary healthcare. A hospital is primarily providing tertiary healthcare services with advanced medical investigations, treatments at the tertiary referral hospital level. So, tertiary healthcare includes cancer management, neurosurgery, cardiac surgery, plastic surgery, treatment of severe burns, advanced neonatology services, palliative care, and other complex medical and surgical interventions. So, the requirement of tertiary healthcare in a government system is what we have as a district hospital with around 5 lakh population, with the number of beds depends on district to district. With a district having smaller population, it could have 113 staff and 100 beds, and for a large district it could have 400 or more than 430 staff members and 500 beds. So next we go to the role of hospital in the healthcare delivery system. So hospital has a very pivotal, very important role because it's a residential establishment which provides round the clock services for short term, long term, observational, diagnostic, therapeutic, rehabilitative services for persons suffering and suspected to be suffering from diseases, injuries and all other things which are being provided. So this has been given to us by the WHO expert committee in 1963. So now what we are doing is that hospitals have not only to be taking care of the sick, but it has to provide a very important role for public at large to make them aware about the prevention of diseases. They should be taking care of the needs of the society. Hence the modern hospitals are not only clinics where diseases are treated, but promotion of health is provided, medical care and other means of prevention, cure and even rehabilitation of patients is done. So it could be a halfway home also. So the basic functions of a hospital are patient care, immunization, counseling of a patient, rehabilitation, coordinating with other staffs of other sectors, medical research, education and training of the manpower, holding workshops and seminars and training and teaching. Classification of hospitals basing on the objectives. So we can classify hospitals on their objectives. It could be a general hospital, specialized hospital, it could be a teaching cum research hospital. Then we have general hospitals. So general hospitals are meant to provide wide range of various types of healthcare services, but with limited capacity. Then we come to specialized hospitals. They limit their services to a particular condition, orthopedics, maternity, pediatrics, geriatrics, oncology, etc. Teaching cum research hospital is a medical college teaching hospital with medical, nursing, dental, pharmacy, education. The main objective is to provide medical care, teaching and research is secondary. So then we have speciality hospitals based on the various systems in the human body. So we could have a nervous systems and a neurology hospital, respiratory system and a pulmonology hospital, digestive systems and a gastroenterology hospital, urinary system and a urology or nephrology hospital. So we have a reproductive system and we could have a uro-oncology or gynecology hospitals. So then on administration or ownership or control or the financial or income, so we could classify hospitals as government or public hospitals, non-governmental or private hospitals, semi-government hospital, voluntary agencies hospitals. So government or public hospitals are owned, administered, controlled by the government and they provide services to the people. Corporate hospitals are the ones in which companies or public puts in their money under the Companies Act and they run on commercial lines like the Apollo group of hospitals. Voluntary hospitals are not for profit hospitals which are run by voluntary organizations like Hope. So there are private hospitals owned by privately controlled individual or group of physicians or organizations which are for profit services. So semi-government hospitals are like municipal hospitals which are run like a private entity. This could be a cantonment board hospital. So then we could classify hospitals based on the length of stay. So if there is hospital for short length of stay, say acute care hospitals where the length of stay is less than 30 years. Then we have long stay hospitals where people stay for more than 30 days. So these could be for mental diseases and things like that. So then depending on the type of medical staff we have. So we have closed staff hospital where all the staff are working full time for the hospital, and we have open staff hospitals wherein people have a arrangement of consultation with the hospital. They could have their own practices and they could come and admit their patients in a hospital, and they could have working as a consultant to the hospital. And then we are basing classification of hospitals on the bed capacity or size of the hospital. So we have small hospitals which are up to 100 beds, medium hospitals which are more than 100 beds but less than 300 beds, and we have large hospitals which are more than 300 beds. So by teaching affiliation, so we have teaching hospitals and non-teaching hospitals, and based on the system of medicine which the hospitals are serving. So they could be allopathic hospitals, Ayurvedic hospitals, homeopathic hospitals, Unani hospitals, or hospitals with other systems of medicine. Basing on the regionality, we classify hospitals as per the WHO classifications, which is regional hospital, intermediate or district hospitals, rural hospitals, tribal hospitals. And then after we've done all these classifications of hospitals, we are now closing this module, and we would request you to see the reference material that we've given to you. There is a very important BIS matrix of classifications of hospitals by various kinds, and the exercises which we are going to give you for this module are based on the reference material which we have given you. Thank you. Jai Hind.